In this video, I want to talk through muscle resisted testing at the foot and ankle. So these are not technically manual muscle tests. You cannot assign a grade to these tests because she is not in the appropriate position against gravity for all of these different tests and muscle groups. However, I find that this sort of testing or quick screening can be effective in assessing the health of the muscle tendon unit as a way to indicate kind of gross muscle strength, but also as a way to test for pain provocation. So this is really important for those reasons, but also because I think it's a nice anatomy review and it really gets you to understand how these muscle groups play out at the foot and ankle. So if we remember our anatomy, we have these two lower leg bones. So we have the tibia, which is going to be more medially. So here's the shaft of the tibia, you can see really prominent. And then we have the fibula, which is lateral. So anytime she moves her foot towards the tibia side into inversion, we're going to be testing those tibialis muscles. So tibialis anterior and tibialis posterior. If she moves her foot into eversion, we're going to be testing preferentially these fibularis muscles or peroneal muscles in the lateral compartment of the lower leg. So that's a really nice way to remember those. I also like to think about this as quadrants. So what I mean by that is you have 4 different quadrants or combinations of directions where she can move her foot in a combination of dorsiflexion and inversion, dorsiflexion, eversion, or she can plantar flex and invert or evert. So those are my 4 options. I'm going to test 4 different muscles or muscle groups. So first thing I'm going to have her do is come up into dorsiflexion and inversion, and that's going to test, we're pointing towards the tibia, tibialis anterior muscle. If she plantar flexes and inverts, that's going to be testing the posterior tibialis muscle. If she dorsiflexes and everts, we're going to be testing the peroneus or the fibularis tertius. And if she plantar flex and everts, we're going to be testing the fibularis longus and brevis, or peroneus longus and brevis. So let me show you a quick little way how I would resist these different actions or these different muscles. And for me, I try to remember my hand is a magnet. So anywhere I put my hand, the patient's going to want to push into my hand. So if I have broad contact and I'm having these hand holds where I have multiple points of contact, her direction of force is going to be kind of sloppy. She's not going to know where to resist, and it's going to be harder on me to apply pressure. So in a very quick way, I can apply pressure by just changing my hand position a little bit. So first off, we're going to go kind of around the clock just like we did. I'm going to have her dorsiflex, so pull up and in. My hand as a magnet applying force is going to be here, so don't let me move you. Tibialis anterior. I'm going to have you point your toes down and in, and I'm going to push. I'm just going to change the direction. Hold nice and strong. Good. I'm going to have you pull up and out. So that was tibialis posterior that we just tested. And this is going to be peroneus tertius. And I'm just going to use my left hand. Stabilize at the ankle. Don't let me move you. Good. I'm going to have you finally point and pull out. And I'm just going to push on that diagonal. Hold nice and strong. Good. And that's very quick, and it's a nice way to assess the health of those muscle tendon units.